All right. Well, good morning, everyone. It is a pleasure to be here. My name is Anand Mantravadi, one of the faculty members at Wills and on the Glaucoma service. And it truly is an honor to be here to speak directly to patients about lifestyle choices and glaucoma. I don't know if you can tell here, these are some of the most famous eyes in art. That's the Mona Lisa's eyes right there. All right, so let's talk a little bit about what we know. We know that your doctor and what you read always talk about intraocular pressure. You know, this has clearly been established as a positive risk factor for glaucoma. Everything we do in terms of glaucoma management is to attempt to lower this modifiable risk factor that we know as physicians can be controlled, and we know as patients when you adhere to some of the therapies, it really does lower the eye pressure, and that's been shown in many clinical trials that intraocular pressure is the main thing that we can do to modify the course of this disease. And we know that regardless of what your starting point in eye pressure, if you have glaucoma, if you lower the eye pressure, you can slow down the rate of glaucoma damage in most people. Now, clearly there are some people who, despite adequate pressure control, might continue to worsen, but the data is very supportive in that regards. But one of the questions that comes up the most often after we have a dialogue in the office is, what can I control? What can I control? So we know the pressure matters. We know that it's a very, very important thing to control in glaucoma. But the question that I get is, well, what can I do, as a patient? Now that you told me I have glaucoma, now that you told me what to do with my treatment, what else beyond, the drops can I do that I can control? And certainly there are things about the disease process and pathway that are out of our control. We can't control the genes that we're born with. We can't control the structure of the eye that we were born with. We can't control our genetics. We can't control the blood flow that gets to the eye. There's a number of things that we can't necessarily control in a very readily manipulatable fashion, but there are things that may be, in your control that you can focus on. And it's really important because people want to take ownership of things, It's one thing when you go to the heart doctor and they say you need to lose some weight and get your cholesterol down and this and that gives you a sort of pathway for ownership. But with glaucoma, sometimes that's a challenge. And you're presented with this burden and you want to be able to just control what you can control. So I'm going to like to talk a little bit about a couple of things that we are starting to develop our knowledge base on. So what are the common questions? What can I do beyond medication and surgeries, and what lifestyle choices can I make? As you'll see later on in the panel today, Dr. Young, Eddie Young, who's another distinguished colleague of ours, is going to talk about alternative therapies for glaucoma. So with regards to some of the details about what I'll mention, I'm going to leave that for him in the context of his studies. So he'll talk a little bit about that. There's a little bit of an overlap. But what we know is that aerobic exercise increases heart rate. It is good for your blood pressure. It decreases your intraocular pressure modestly. And the diastolic blood pressure, all good for the heart, but also very, very good for the eye. And we know that it improves cardiac health, and we are looking at longer-term data in very large cohorts that suggest that improved cardiac health influences glaucoma development. And it can also alter the blood flow, which increases perfusion to the eye, which can also be very, very healthy for your glaucoma. But it's also important before you start an exercise program just on your own cognizance that, you check with your doctor, make sure that, you're of adequate fitness. Don't go from 0 to 100 miles an hour the first day. All right. So diet, everyone wants to talk about diet. I think that it's nice to finally see some robust evidence over a period of many years that supports basic common sense. Basic common sense is that you eat well. And if you eat well, the eyes are connected to the body. So what's good for the body is probably good for the eye. That's just a kind of a guess. But now we have, very good data following a large cohort of nurses over a period of many years. And it's been shown that basically higher dietary nitrate and green leafy vegetables are associated with lower primary open-angle glaucoma risk. And this is looking at nearly 10,000 women and men over a period of 26 to 28 years. So very, very long duration of study. So what are the maybes? I get a lot of questions about alcohol, caffeine, tobacco. I think that as you'll see in the next slide, I think, and as Dr. Lee had mentioned, moderation in all of these is okay with exception of tobacco. I mean, caffeine has been shown in excess amounts to increase intraocular pressure. Modest alcohol consumption can reduce intraocular pressure modestly by a couple of points. Tobacco, clearly negative for eye health in so many ways, not only in the macular degeneration world, but also in the glaucoma world. We do think blood flow is very, very important with glaucoma, and, tobacco, unfortunately, causes a lot of, diminishment of blood flow to the eye in a number of ways. So supplements, I get a lot of questions about this as well. I think, there is mixed evidence for all of these: magnesium, ginkgo, oxidative stress, dark chocolate, bilberry extract, red wine, tea, coffee, melatonin, ubiquinone. So a lot of patients who have a lot more experience in the nutrient world, more so than I do, will bring up these things. And, we can find data that is both for and against this in a number of different ways. And I think the take-home message is that in the vitamin world, the supplement world, there isn't much longitudinal, randomized, controlled data that as scientists we would probably hang our hat on a little bit more than just looking at a small cohort of patients. So what I tell people is, it's important to do your own reading. I mean, in the pure science of it, we can't really condone or say that it doesn't work. There is evidence that supports, to some degree, role in a lot smaller settings and for all of these. But we really don't know. We really, really don't know. Ginkgo does increase blood flow. Bilberry does increase blood flow in small cohorts of patients. I will caution you, though, with ginkgo, it's important that if you are planning on undergoing a procedure, for example, a colonoscopy or a glaucoma surgery, for example, it's important to notify your physician about ginkgo because it does increase slight bleeding tendencies like an aspirin does. But, this whole slide reminds me of our good friend Donald Rumsfeld. As we know, there are known knowns. There are things we know we know. We also know there are known unknowns. That is to say, we know there are some things we do not know, but there are also unknown unknowns, the ones we don't know we know. So I think that's a good take-home message for supplementation. Lifestyle. You probably in your own reading, if you're here, you're a very active participant in your own health, so you probably have done your own reading that, yoga, has been associated with increased intraocular pressure. What is known is that if you have extended inverted positions, that you do raise the eye pressure. That's known. Tight neckties increases eye pressure. Weightlifting, anything that we call valsalva, so you're breathing against a closed glottis, you're bearing down, you will increase the eye pressure. What is unknown is what's the relevance of that. What is unknown is what's the relevance of that. And I think that's really important. Okay? We know it raises pressure. Do we know it's actually bad for you? No, we don't know that. We don't know that that this would actually cause glaucoma to progress for you as an individual. Now, your doctor might say, hey, look, your glaucoma is at a certain stage. I am concerned with this level of extended intraocular pressure with inverted, but, for the general population of folks who have glaucoma, I don't think anyone can tell you that we know that it is going to cause your glaucoma to progress. So I always tell people that, diets and lifestyles that we don't have, strong evidence for, but, provide you value in your life and add to your quality of life. I think that we have to kind of recognize where the science stands before we start making, serious recommendations that you should alter your lifestyle and give up your clarinet. So there are other medical conditions that are associated. We talk a lot about blood flow. There is association with things that cause spasming of some of the blood vessels with glaucoma. So things like migraines, you've heard of maybe Raynaud's phenomenon when you're getting outside in the winter and your fingertips are very cold, low blood pressure, sleep apnea. In a number of different studies, these have been associated potentially with glaucoma. Again, control what you can control. There's really no evidence that suggests elevating your blood pressure actually is good for you. In fact, just the contrary. But lowering the intraocular pressure can increase blood flow to the eye too. So that's probably the safer way to go. I'll briefly touch on this. Dr. Young will talk about it. This is a question that comes up in our office quite a bit about marijuana and glaucoma. And I will just say that not delving too much into the science because Dr. Young will do that and I don't want to steal his thunder. This is a very popularized concept. Unfortunately, there are very public figures who have made it, made statements that have supported it. But I'll just read the position statement of the AGS, which is although marijuana can lower the intraocular pressure, its side effects, short duration of action, coupled with the lack of evidence that its use alters the course of glaucoma, preclude recommending the drug in any form for the treatment of glaucoma at the present time. It does lower the eye pressure, but very transiently, and unfortunately, the amount that does need to be consumed and the formats in which it's consumed to achieve the same types of pressure lowering that a medication once a day would achieve would probably cause far more untoward health issues for you than taking a once daily drop. So that's kind of the position of the American Glaucoma Society. It's not something that typically glaucoma physicians dispense for the purposes of treatment. So in conclusions, I think as Dr. Spaeth always mentions, and is I think important not only for your eyes but for any part of your life, take control over what you can control. I think that's really important to kind of get a sense of ownership of your own disease. There are things that are out of your control. What you were, like I said earlier, what the cards you're dealt with might be out of your control. But take control of what you can control. Be an active participant in your health. And I think also it's worth mentioning that be careful about what is an association and what's real science. And I think that you're going to come across probably a number of different articles that say this is associated with that or that is associated with this, not just in glaucoma but about all your health. But it's really important to kind of distinguish what is an association and what is real science. And I think that will help kind of limit how confusing some of the mixed messages could be. So with that, I'll say thank you very much and open for questions.